What are some strategies for self-care that actually work? And how do you combat negative self-talk? I'm Dr. Sasha Hamdani. I'm a board-certified psychiatrist and ADHD clinical specialist. And today I'm going to answer the internet's biggest questions about ADHD and self-care. Why do people with ADHD struggle with self-care? People with ADHD struggle with self-care because they have difficulty prioritizing themselves. And part of that is just issues with prioritization in general. In order to be able to do that, you need to understand executive function. You need to be able to plan. You need to be able to execute the tasks. When you're dealing with that, you also have difficulty with motivation unless the task seems urgent or super interesting to you. On top of that, you're often dealing with emotional overwhelm, which makes things seem like a mountain. It's not laziness, it's neurological. This could show up as difficulty getting groceries, difficulty brushing your teeth in the morning, difficulty doing laundry. All of these things require a breakdown of multiple steps in an organized fashion. This has nothing to do with laziness. This is your brain literally receiving multiple pieces of information and struggling to organize it. What are some self-care strategies for ADHD that actually work? Visual cues, timers, and routines are your friends. Visual cues, things like putting your medication by your toothbrush so you don't forget it. For timers, timing out the length of your shower or timing out the length of some other task that is really boring that you don't want to do. For routines, things like checklists or apps are really going to be helpful. Pick small, specific goals and just make self-care as accessible as possible. The goal isn't perfection, it's consistency. Why does ADHD make showering such a chore? Showering requires multiple steps, sensory input, and transition between tasks. For people with ADHD, that can feel overwhelming. If you're tired or dysregulated, it's even harder. What I recommend is setting a timer or using your favorite song to time it out so it's a little bit more stimulating for you. Or you can set a little reward for yourself as motivation. I enjoy watching a show after I take a shower. The important thing is that you find something that works for you. One technique might not work for everybody. Try it out, see what works, and that's how you maintain consistency. How can I create a self-care schedule I'll actually stick to? So the trick for this is keep it simple and keep it specific. So instead of writing self-care in your calendar, write an actual task you could do, like take a walk for 10 minutes or call a friend. Another technique that has really worked wonderfully for myself and many patients that I've worked with is something called habit stacking. Habit stacking is when you add a task onto something that you don't typically forget as a way to incorporate that into a routine. So what that might look like is that after your morning coffee, you might look over and see your pen, which you've left by your coffee station. And that's your cue that you might want to start journaling. You don't need to restructure your entire life overnight. Pick one task and habit stack from there. By the way, what's your biggest challenge with self-care and how did you overcome it? Share your experience with us in the comments. How do you do basic self-care? Start with the basics. So that's sleep, movement, food, hydration, connection. And you don't need to rehaul your entire routine overnight. Start with something small and work from there. So a lot of people struggle with hydration, and sometimes it's just as easy as starting your day with a glass of water and ending your day with a glass of water. Another thing you could potentially do is try to incorporate a little bit more movement into your day, and that can look like taking the stairs instead of taking the elevator. Another thing you can look at is taking a 10-minute walk during your lunch break. The reason why this is helpful is because movement pumps that good oxygenated glucose to your brain, which is exactly the fuel that it needs. And that's helpful for everybody, but especially important for people with ADHD. Just celebrate your small wins. Over time, they turn into real habits. Can ADHD make rest feel uncomfortable and unproductive? Yes. When your brain is used to constant stimulation, or if you feel like you're constantly running behind, it can make rest feel like it's counterproductive, or you can feel really guilty for taking that time out for yourself. This is something that everybody probably struggles with to some degree, but it's really pronounced with people with ADHD. Learning how to rest without guilt takes practice. But it's worth it. Just starting to think about rest as being something productive you can do for yourself is the shift that you need to take in order for you to actually lean into resting. How do I balance self-care and self-discipline? Think about it like working with your brain instead of against your brain. Self-discipline doesn't mean that you have to push yourself through the point of burnout. It's more that you're building systems to maintain consistency. That might look like using reminders, or breaking tasks down into smaller tasks, or asking someone to help you to keep you a little bit more accountable. Discipline doesn't have to be overly rigid, and it doesn't have to mean that you have to be mean to yourself to do it. Compassion and structure can work together. How do I combat negative self-talk? I break this down into 3 different steps. Number 1, start by catching it. Number 2, pause and ask yourself, would I say this to someone that you love? And number 3, try replacing it with neutral or kinder thoughts. This eventually over time is going to help you rework that dialogue to something a little bit more supportive. To further untangle these complicated, deeper patterns, you can talk to a mental health professional. And if that's not accessible to you, you can also utilize journaling, which is a great way of recognizing your own patterns. You can use that same 3-step technique with journaling. Catch it, ask if you would say that to someone you love, and then rework it to something a little bit more supportive. One thing to note is that people with ADHD have experienced a significant amount of negative feedback over the course of their lifetime, so it's especially important for them to speak to themselves kindly. Did you like this video? Because we have a lot more resources like these on our channel. So go ahead and subscribe to get the latest research and tips from experts like me on learning and thinking differences, including ADHD and dyslexia. Thanks for watching.